SALMETEROL, and that is my generic name. My brand names are Advire Discus and Air Duo Respir Click. My chemical name is this, or C25H37NO4.
Now, let us talk about my drug classifications. My therapeutic classifications are bronchodilators, anti-asthmatic, and COPD preparations. Meanwhile, my pharmacology classifications is selective beta-2 adrenergic stimulating agonist.
My pregnancy category is category C. Salmeterol is known to cross the placenta and the breast milk. Studies in animals have shown or have revealed adverse effects on the fetus, and there are no available studies in women and animals. Drugs should be used during pregnancy and lactation only if the benefit to the mother clearly outweighs the risks to the fetus or neonate.
Now let's talk about my mechanism of action. I'm sure you're all curious about it. So, I stimulate intracellular adenyl cyclase, which is the enzyme whose job is to catalyze the conversion of ATP to cyclate 3,5 adenosine monophosphate, or CAMP, that results to the relaxation of bronchial smooth muscle and the inhibition of release of mediators of immediate hypersensitivity from mast cells. It is hypothesized to bind to two sites on the beta-2 adrenoceptor. The seleginine moiety binds to the active site of the beta-2 adrenoceptor. Meanwhile, my hydrophilic tail binds to the leucine residues in the exosite of the beta-2 adrenoceptor almost irreversibly, which allows me to persist in active site, which is responsible for the long duration of action.
My indications are persistent asthma, prevention of exercise-induced bronchospasm, maintenance of airflow obstruction, and prevention of exacerbations of COPD.
Now let us talk about my contraindications. Let's start off with milk protein hypersensitivity. I contain lactose and milk protein, so I am contraindicated with patients who demonstrate severe milk protein hypersensitivity. I am a big no-no for monotherapy treatment of asthma. I should not be used without an asthma controller medication. I am contraindicated in acute bronchospasm or status asthmaticus. I should not be initiated in patients with deterioration of asthma or used in episodes of status asthmaticus. I am not a substitute of oral corticosteroid therapy or inhaled corticosteroid therapy. Corticosteroids shall not be reduced or stopped when I am initiated. Subsequent changes in the corticosteroid regimen should only be made with a thorough clinical evaluation. I am contraindicated with patients with congenital long QT syndrome. They are at risk of torsade response. Significant changes in systolic and diastolic blood pressure are to be expected after the use of any beta-adrenergic bronchodilators. I should be using caution in patients that has a condition that may increase the risk of prolongation, including certain cardiovascular disorders. Next up is hepatic disease. I am predominantly eliminated by hepatic metabolism. I should be using caution with patients who have hepatic disease or hepatic disorders, as drug accumulation may occur. Next, we have paradoxical bronchospasm. This can occur after treatment with salmeterol, and this can be life-threatening. If this occurs, discontinue using me immediately and provide any supportive care. Lastly, I am contraindicated in geriatric patients. They may be more sensitive to the side effects of beta-agonists, especially tremors and tachycardia. As with the other beta-2 agonists, I should be used with special caution in patients who has concomitant cardiovascular disease that may be adversely affected with beta-agonists. Elderly patients may also be at an increased risk of QT prolongation.
My CNS adverse effects are headache, sinus headache, tremor, nervousness, giddiness, and hyperglycemia. Meanwhile, in the cardiovascular system, tachycardia, palpitations, ventricular arrhythmias, chest pain, and high blood pressure. My adverse effects in the eye, ear, and nose are nasopharyngitis, nasal cavity disorder, and sinus disorder. In the gastrointestinal system, nausea, diarrhea, vomiting, and heartburn. In the musculoskeletal system, joint and neck pain, myalgia, osteoporosis, and slow growth in children. In the respiratory system, upper respiratory tract infection, lower respiratory tract infection, cough, and bronchospasm. Meanwhile, in the hematologic, Churg-Strauss syndrome and conditions caused by an increase in a type of WBC. Lastly, the effects in the central nervous system, hypersensitivity reactions, eye problems, eye pain, blurred vision, halos around lights, loss of night vision, light sensitivity, and yellow tint to our vision.
The nurse's responsibilities before administering me is that the nurse should assess for the mentioned contraindications or cautions to prevent any complications. The nurse should also perform a thorough physical assessment to establish baseline data before drug therapy begins to be able to determine its effectiveness as well as to evaluate for adverse effects. Third, the nurse should assess for presence or history of chronic asthma, acute asthma attacks, and acute upper airway obstruction. Fourth, the nurse should assess respiratory rate and lung sounds, pulse, BP, EKG, and liver function. Next, the nurse should obtain EKG and complete blood studies, CBC, chemistry panel, and liver function studies. Next is that the nurse should assess patient's drug history to determine possible drug-drug interactions and allergies. Lastly, the nurse should evaluate liver function tests to assess for changes that could interfere with metabolism of the drug and require dose adjustments.
The nurse's responsibilities during drug administration are:
Instruct the patient not to breastfeed while using this drug. Instruct the patient not to use an additional dose prior to exercise if taking twice daily doses of salmeterol. Special precautions should be taken to avoid the combination of salmeterol with the general anesthetic cyclopropane and halogenated hydrocarbons, because these drugs sensitize the myocardium to catecholamines. Serious cardiac complications could occur. Teach patients who use SALMETEROL for exercise-induced asthma to use it 30 to 60 minutes before exercising to ensure repeat therapeutic effects when they are needed. Provide safety measures as needed if CNS effects become a problem to prevent patient injury. Provide small, frequent meals and nutritional consultation if GI effects interfere with eating to ensure proper nutrition. Offer support and encouragement to help the patient cope with the disease and drug regimen.
The nurse's responsibilities after administering NE are: first, they have to notify physician immediately of worsening asthma or failure to respond to the usual dose of SALMETEROL. Next, they have to monitor cardiovascular status or to report tachycardia in particular. They have to monitor liver enzymes periodically with long-term therapy. They have to observe for wheezing, withhold drug, and notify physician if bronchospasms occur following its use of the drug SALMETEROL. Next is to monitor EKG and electrolyte values. And lastly, they have to monitor the neurological status of the patient.